Okay, cool. Good afternoon. This is Dr. Larry Kidd, once again from Henry Mayo Newhall Hospital. I'm here with Dr. Bud Lawrence, who is Director of our Emergency Services, Emergency Department Physician. And we are here to address questions that we previously received and also to share a few updates regarding things at the hospital. One of those items is a change in practice consistent with the governor's requirement that individuals maintain in their homes over the next several days, as well as consistent with the other hospitals in the community across the country that are changing. That practice has to do with changes in our visiting hours. Previously, we had pretty flexible visiting hours, and as of tomorrow, we will be restricting visitors to the hospital. So we have been communicating with our patients, their families, to let them know for their increased safety and in compliance with the mandates that have been provided to us by the state and the county regulatory requirements. We will no longer allow visiting hours routinely in our emergency department unless that visitor is accompanied to accompany a minor child. We also will restrict visitors in our women's unit, in our intensive care unit. There would be exceptions for visitors in those two areas as well. There is an administrator that is available to the hospital. There is a nursing supervisor in place, and they will review any exceptions to those policies. But we're asking that individuals adhere to our new policy, consistent again with requirements in other facilities. We also would like to direct you to our website, which also will provide more details and specifics about those visitor restrictions.
All right, thank you, Larry and Dr. Kidd. I'm, again, Bud Lawrence, as you mentioned, and this is now the third time or so that I've been here, and I'm happy to answer some medical questions that were provided on our last Facebook Live. I want to remind you, too, that as we go through this Facebook Live, if you'd be so kind to put your questions in the comment section so that we can have some questions to answer on the next Facebook Live, which I believe will be Monday of next week. So coming in with some of the questions that you brought from a medical perspective, this is a question that was repeated multiple times, but if somebody is diagnosed with COVID-19 and recovers, basically, can they get it again? This is a great question, and the jury is kind of out on it, but I think the answer would be, theoretically, if you've been exposed to COVID-19, you should develop some element of immunity to that viral infection. But there have been documented cases, not common, this is fairly rare, but there have been documented cases already of patients that have gone through the infection process, recovered, and then only to become infected yet again with an entirely new course of illness. So again, fairly rare, but we do have to remember that this is an RNA virus, and RNA viruses, as we talked about before, don't do the best job of replicating, which leads to mutations. And so sometimes that mutation could put a person at risk for getting infected again, or perhaps their immune system didn't respond completely on the first infection. So great question. I think in general you should be somewhat protected, but there's not enough data out there to say one way or another.
We've received a number of questions regarding the testing for COVID-19. Again, as we previously mentioned in our last session, the process for getting a COVID-19 test has to do with initially having a screen for the test. So based on CDC criteria, individuals are determined whether or not it's appropriate to have a test. We also had questions about the time that it's taken. We hear that there are individuals in the community discussing the fact that it has taken several days to receive the results of a test. As more and more tests are put into the system, more and more providers, hospitals are requesting tests, that is increasing the workload on the laboratories. So what we're seeing right now is it could be anywhere from about 5 to 7 days to receive the test results. Could be a little bit less, a little bit more than that. We do understand that additional laboratories are being supplied to be able to do this test, and at some point, individual hospitals will be able to also run these tests. So with those advancements, we expect that we'll see better turnaround on those tests. But there are a lot more tests in the system again, so therefore the longer time to receive the results.
And just to kind of piggyback on what Dr. Kidd said about test results is if someone does test positive, this isn't going to count as my question. If someone does test positive, how do they know that they're negative? In the past, the recommendation was that they had to have 2 negative tests greater than 24 hours apart. Recently, that was changed to 14 days since the onset of illness, or 3 days after your fever's been gone and your symptoms are improving. And that was just recently changed now to 7 days from the onset of symptoms, or 3 days of no fever and improving symptoms, whichever of those two is longer. So, which is really great news for our community members that do test positive, because that's a much easier get-out-of-jail-free card than having to find a place to get tested and tested again to ensure, and even maybe again, to ensure that you are indeed negative. So another question that's come up multiple times, the person is asking the same question and wants it answered, which I think is reasonable, is concerned about seniors, middle age or younger, age differences, and how this affects people with COVID-19. So clearly we've talked about before that the elderly are much more, that population is at more risk than the younger populations. Although we do see occasionally significant infections that occur in people in sort of like that 19 to 45, 50-year-old range as well. And I think it's important to know that I think there could be a thought process going along, since you may have heard things in the news, that younger people tend to not have such bad issues with this infection. But remember that young people, you may feel like you're invincible, but the reality is that even young people can get this infection in their lungs in a way that there's some data coming back showing that they may have decreased lung capacity after the infection leaves your body as a permanent consequence of having an infection. So I think the thing that I'm trying to say is if you have the opportunity to stay home, self-quarantine, stay away from sick people, use your social distancing. Even if you're young, you're not invincible. This is something that has the potential to affect everyone. So please keep that in mind.
As Dr. Lawrence indicated, I cannot emphasize as well enough the fact that staying at home, not entering into the public, is only required for necessities such as going to a grocery market, that sort of thing, will drastically reduce the potential risk and exposure of this virus. So that is one of the things that individuals can do. I also noted a question asking what else could the public be doing to help support hospitals and patients during this crisis. And one of those things is to donate blood. There is some discussion I'm hearing that folks are reluctant to donate blood, thinking that it might not be safe to go to blood donation sites. That is not the case. In fact, we had a blood drive here on Wednesday of this week, and through marketing and promoting of that drive, we had an overwhelming response from the community and our own employees who donated blood. As a result, we had many more people show up than we anticipated, and we were very pleased with that. So I would plead to those that are listening to consider blood donation. There's a very safe process that you would go through before you would be able to donate blood. The environment is perfectly safe. There are procedures in place, so individuals are screened. And if for some reason that day you were not a candidate, don't feel that your showing up to draw blood was in vain. But certainly our nation's blood supply has dwindled quite a bit since the increase in the COVID-19 virus entered into our society. So please consider donating.
Very, very precious resource that is very much needed, particularly where, as you know, we are a trauma center, and we utilize blood products not infrequently. Quick question. If someone's test comes back negative, can they still test positive in the next few days? So that's very important. So we are testing community members, and community members even maybe getting tested outside of the valley here, the Santa Clarita Valley. If you have a negative test, that test is negative for that moment that you were tested. So there are many factors that go into a negative and a positive test that are probably too granular to discuss here on this forum. But if your test is negative, that doesn't mean that you might not have a positive test later on if for some reason you were on the very early course of your illness, or perhaps you may not have been infected yet. I think that it's important to remember, again, we'll continue to say this, that the majority of people who do get a COVID-19 infection that are dealing with this have a very mild course of illness. So just keep that in mind. Obviously, testing is very helpful. Testing is a very limited resource that we hope in the near future we will get the ability to perhaps test people much more quickly and have faster turnaround times.
Very good. One of the many questions we receive has to do with what individuals are seeing in the media around equipment. Do we have enough masks? Do we have the appropriate personal protective equipment that's required, ventilators, et cetera? Currently at our hospital, we do have adequate supplies to provide care. We have the appropriate masks. We have the appropriate equipment for individuals that are experiencing respiratory difficulty should they present to our hospital. However, these resources are precious, and because we don't know the extent of what we're going to be faced in the coming weeks, it's very important that we maintain and use these supplies judiciously. We have had outreach from volunteer donations from the community. Of course, we must use hospital-grade materials, et cetera. So we welcome the support that we're receiving, but do understand if individuals donate items to us, we would not necessarily be able to use those all the time, that we must maintain CDC guidelines. We also are closely in contact with the Department of Health, the state, regarding supplies that are being released from the federal government. There are ventilators and other equipment that's stockpiled at our government level, and we're seeking to be a part of that distribution as well. But currently, we're able to provide the care appropriate to the patients that we're seeing.
So maybe last question here, as we're kind of getting long on time, is how are you tracking Santa Clarita cases if patients are not going to Henry Mayo for any services or happen to go somewhere else? So I think it's important, you will see this on the news or on local agencies that they're reporting how many cases we have in Santa Clarita. As we have disclosed in the past, we have 3 positive cases that we have tested here. That's on our website, I believe, as well. I think it's important to understand that any time that there is a positive test, it is reported to the Department of Public Health, the Los Angeles Department of Public Health, and that entity is what is giving the information to the news agencies. So any number that you see for Santa Clarita is likely an accurate number, but that may be a different number than what we are reporting, only because these people there are many places to get tested, and these patients may have been tested elsewhere. So I think that's important. I do encourage you to put your questions in the comment section so we can follow that, track that, and get you answers to the things you want to know. After all, that is what we're here for. Isn't that right, Dr. Kidd?
That is correct. And we thank you for joining us today. We look forward to the next session, which is scheduled for Monday. And we hope that today's session has been beneficial to you. Thank you, and take care and be safe out there.